It's 4:19 and it's time to go in depth on Portland's afternoon news. Governor John Kitzhaber announced a health care reform agreement today with the Obama administration to help ensure continued Medicaid support for Oregonians, even in the face of reduced funding.
With us now is the president of OHSU, Dr. Joe Robertson. What's your reaction to the news?
Well, first and foremost, this is terrific news, and kudos to the legislature for being forward-thinking and for having a governor with the vision and the persistence to make this a reality, because this is the money that we have now to invest to make transformation a reality in Oregon. Any process where you induce change actually takes an investment up front, and this gives us the opportunity to make the investment to change the system to one that is more coordinated and more collaborative. I'm incredibly enthusiastic about this. I would even go so far as to say this changes it changes the stage. It changes the situation from where transformation is a possibility to making it actually the responsibility of every Oregonian. The eyes of the nation are now on Oregon.
What kind of difference will this reform make here in Oregon?
Well, the key word is coordinated, and this will now be initiated in the Medicaid population, and the goal is to get all parties involved in the care of this patient population involved in a coordinated and collaborative manner. That means providers, health systems, the counties, even the patients themselves. It will allow us to bring in fact, a new class of healthcare workers, people that will help patients navigate the system so they use the system more effectively, and when they use it more effectively, both the outcomes should improve and the cost should diminish. Some of the key areas that are ripe for savings include better treatment and management of chronic and complex diseases, avoidance of unnecessary trips to the emergency department, coordination of behavioral health, medical health, and dental health. So I think those are some of the changes that you will see. Part of this is also made possible in this era because of better electronic medical records, better health information systems, because the systems need to be set up so that the information about the patient follows the patient wherever the patient goes.
And how's OHSU going to be involved in this reform?
Well, OHSU will be very involved. I mean, just from a real practical perspective, we will be involved because we're a public institution. We're the state's only academic health center, and even though we have only 10% of the hospital beds, we provide roughly 20% of the inpatient services for this patient population.
That's OHSU President Dr. Joe Robertson going in depth with us on the agreement announced today between the state and the federal government on a new coordinated Medicaid program to be implemented here in Oregon.